This week on the podcast, we're going to talk about Medicare and open enrollment. It'll be on top of us before we know it. So let's get into this conversation with Coach.
In football, the red zone is where a team has to make small adjustments to ensure victory. As you approach retirement, you also need to make small adjustments to ensure success. This is the Red Zone Retirement Program with registered investment advisor and enrolled agent John Mears of Mears Money Management.
Hey everybody, welcome into the show. Thanks for hanging out with us here as we talk investing, finance, retirement. And yeah, all right, look, don't click it off because I've got Medicare in the title. It's important. we gotta talk about this thing. It's pretty important. It's a little costly, and there's a lot of things we need to be aware of. So we're going to talk about open enrollment period, Coach. It's going to be on us pretty quickly. This is late August when we're dropping this podcast, so like a month it's going to be here. So it's worthwhile to have a conversation on this stuff. But how you doing this week?
Doing great. As we're recording this, in the heart of football season. So enjoying yelling at 14 and 15-year-olds as the JV coach at the local high school. But we have a lot going on in the financial world in my in my practice where we got annual reviews coming up, and then we have again the Medicare enrollment period, because that is something where people always have, and it's not always people having a million questions. They all have one, but it's one big question.
Yeah. There's usually a couple that wind up biting us in the tush a little bit. So let's talk about them a little bit. So open enrollment period is that annual time frame when people can, go in and make those changes. And I'll got a couple of slides for us to pop up while you're talking about some of this stuff. So what's the lowdown here? What's some things to think about?
So the main thing is from October 1st to December 7th. I don't know why it's December 7th, not December 15th or December 31st, but it's December 7th, You have Medicare Open Enrollment Period. So you are able to make changes to your Medicare. This is, if you're already in Medicare, you can make several different changes. You can, if you want to, you can join, drop, or switch to another Medicare Advantage plan. If you're on Medicare Advantage, you can add or drop drug plans. You can switch from original Medicare to Medicare Advantage, or vice versa, from Medicare Advantage back to original Medicare. And we can also join, drop, or switch to other Medicare drug plans also. So there's just the basic thing here that we're trying to get through to people is there's a lot of changes. If you have changes you got to make, this is the time to do it, because there are limitations with some of the other enrollment periods. But with this period, it's really, if you need to go in, you need to go out, if you need to switch plans, this is the time to do it, because there are, again, restrictions on the other periods.
Yeah, so you kind of covered some of the stuff, and I popped that up there on slide 2 for us about some of the things that we can do. And again, it's a weird time frame, and I'll go back to this other one real fast. There are some later stuff, right? Like, so January 1st to March 31st of, I guess it would be the next calendar year, Medicare Advantage open enrollment period. That happens then. So, there's some windows there for different things. And you mentioned some of the stuff that you can make the changes to. But really what it comes down to is shopping for and dealing with some of the stuff, because we don't really... You kind of need to work with somebody who understands this stuff, because there's a lot of nuance to this, yeah?
There is. And I'm going to get full disclosure here. Even as I'm doing this podcast, I have notes that I'm referring to, because...
Refer to them.
It absolutely is. Even for me, it can get complicated. So, we kind of know the basics. Most of us that are in the industry, well, maybe not most of us, but many of us in the industry know, it always starts with, again, when do we sign up for Medicare? That's always step A. And that's always people that are always asking, when do I do it? There's actually a 7-month period, three months before you turn 65.
Yeah, and that'll bite you, because that'll bite you, because my brother screwed that up this past year when he turned 65. I kept telling him, I'm like, there's a 3-month window, don't forget. And he messed around and didn't do it. And then when his final paycheck happened, he was bummed because he wasn't going to get his Medicare check for he wasn't going to get his Social Security. And then the Medicare part tied together for 3 months. And he was all like, crap. I said, I tried to tell you.
Yeah. And they have different penalties too for Part A and Part B. It can get confusing, folks. I totally understand that. So Part A, which is hospitalization, if you're late with that, the penalty is basically 10% for each month that you didn't do it. So you kind of get penalized forward. So if you're behind by, I'm making up a number, 6 months, they'll penalize you 10% for 6 months. However, with Part B, it's 20%, and they put the hammer on you a little bit more for the actual regular doctor care, if you will, which is Part B. So they're just, and I don't know how the average person can keep track of that. Now, it's funny. I'm not a big fan of how the government does things, but the Medicare website is halfway decent. You can kind of navigate around there, but if you are not, if you're easily confused, you can get confused. But if you need information, it is there. I do suggest on this that if you don't use an advisor, there are some Medicare specialists out there you can go to, and they'll charge you. They don't do it for free, but they'll kind of go through a plan. It'll be about, depending on what you have going on, anywhere from $500 to $1,000, but that may be money well worth it to kind of, again, we were going to talk about prescription drugs, which is part D. Again, we've got the whole alphabet here, but the part D, which is the prescription drug medicine, which may tie into, I'm going to confuse everybody here even more, how you do your Medicare Advantage, which is part C. So it gets very confusing.
Yeah.
Here.
Well, D for drugs, if you want to make it easy.
It is for drugs, yes.
Yeah.
So, but it is so confusing for a lot of people.
Okay, so let me touch on a couple of things. So you mentioned Medicare specialists. Many advisors, actually, I talked to them all across the country. They still wind up saying they have a specialist on that they kind of refer people to.
Yes.
Sometimes they have them working in the office. So it's certainly definitely worthwhile to find out, because they just deal with these nuances day in and day out.
I do I go two ways here. I actually do have a software analysis, which I will use if we're going through the planning process, which we can do. If something gets a little more complicated, I do have a specialist that I can refer out to if it's just getting to the point where it is too far. But I like to keep it in-house if I can.
If you can, yeah.
And we usually can. But every now and again, we get something that gets a little bit beyond where I'm comfortable with. And at that point, just like if you were going to an attorney, you want to make sure you find somebody that really knows what they're doing in that industry. One way or another, for my clients, we'll get you taken care of. We will help you.
Well, I mean, if you're a head coach, right, you have a good knowledge about everything, but maybe you don't really have you're not keeping up on all the latest things for the wide receiver position. So that's why you have a wide receiver coach.
Yes.
Right?
Yeah. We all have our position coaches, an offensive coordinator, defensive line coach. Yeah. They're the ones that spend all their time on their one thing, where I spend my time on everything. Yeah,
yep, exactly. All right. So what's some of the things we should consider if we're shopping for Medicare for during open enrollment? What's just a couple of bullet points for folks to think through? And take a look, read them off there, whatever you got. I know we got some notes we're referring to. So
obviously the costs, if we're looking at open enrollment, you want to always be able to compare costs. That's where the software comes in pretty handy if you're working with somebody on that. I also look at healthcare needs. People's needs change. I take some medicine. I know everybody has their own nuances with medicine. And so you want to make sure that any changes in the cost of your medicine, if you have added a prescription or lost or don't need a prescription anymore, those are things you're going to be adding and deleting as you go through this. You're looking at plan quality always. I do believe in the idea that you can track and see who these days with Yelp and all these other services, kind of, hey, I can check and see who's got a 5-star rating, 4-star rating. You can also see what people's comments are. We all do that when we go on Rotten Tomatoes, right? We all see, okay, what movies we're seeing or not we're seeing. You can do that with just about anything. You can do that with including your medical plans. And then one thing that I talked about in a previous episode a couple months ago when we talked about travel plans is what type of supplemental policies may be in existence with each provider. If you're going with Medicare Part C, Medicare Advantage, provider may say, okay, yeah, we'll cover you if this is going on when you're traveling. Others may not, and that's something that's really important to know. Okay,
definitely very important to know. What happens if we miss open enrollment?
You're screwed. Okay, if you miss open enrollment, there are you can get
pop up on a cold one if you miss it, right?
Yes. Yeah, so if you miss open enrollment, there are limited times where you can actually go back and fix these things. So those dates, and I don't even have those dates in front of me. I lost them as I was scrambling here. But there's a limited time period when you can actually, let me back up a little bit. If you have a major life change and you're in Medicare Part C, you basically can do it within 2 months after this major change. So the classic is if there's a big health issue that pops up, or if you move from one area to another. So that's one thing you can take care of immediately, and you can do that at any time within the 2 months of that initial event. Beyond that, you're generally having to wait until the open enrollment periods, or else you're stuck with where you're at. This is why it's so important to do something during the open enrollment period. So we have that popped up here again.
Yeah.
So
Yeah. I went and
really
looked real fast just to make sure. But yeah, so if you do miss it from October 15th to 7th, you can still get some stuff done, but there is a couple of hoops you got to jump through. So yeah.
Yeah. And I always tell people, again, Social Security is pretty helpful. Medicare, actually, if you call them, they will actually be somewhat helpful as well. You can call them up, and they're not going to yell at you. They're not going to. I will give the caveat that they are government workers. They were not always 100% correct, but for the most part, my experience with my clients is that they've gotten pretty good advice, and then they run it past me. I will double check as well. Again, there's so many things flying around here. It's like I feel like I'm watching Twisters 2 again, because there's so many things we have to kind of tie together to push forward to make sure that we are getting you taken care of.
Yeah, and if you're already enrolled and you're not making any changes, you don't have to worry about the open enrollment period, right?
Nope.
It's just
Nothing
status quo,
Nothing
keep
to do.
moving on. Yeah.
Yeah.
Okay.
Nothing to do. And that is for most people, actually, which is why I say that when we have the open enrollment period, I'll get somebody who'll ask one question. It'll be a big question, but most people just keep plugging along the way they are. And if you do make a change during the open enrollment period, it's effective on January 1st of the following year. It's not immediate. You'd have to wait for that. So if you make a change in October, it still isn't effective until January 1st. So.
Okay. All right. So 6 key reforms were passed in 2022, Coach, for Medicare as part of the Inflation Reduction Act. We'll see those final 2 changes kick in place in 2025, and it's around some of the drug stuff. So I'll pull that slide up for us as well.
Yes. So we're looking at the out-of-pocket cap, which is what was I think that's a pretty good deal here as for seniors. Again, I'm not always a big fan of how the government does things, but this is something that made sense.
Okay.
An annual limit that caps out-of-pocket expenses at $2,000 starting next year. So that's pretty good. And then anyone with a Part D plan, the option to pay in the form of capped monthly payments instead of all at once.
Gotcha.
At the pharmacy, that's also a pretty good one here. So there's a couple good things in there that I like that makes sense. Kind of a smoothing, if you will, of being able to make your payments instead of, hey, I got a big lump here where I pay for a prescription and then another big expense at that point. You can kind of smooth it out. That makes sense to me.
Yeah. So that's about $1,250 savings there from the prior year. Hey, nothing to sneeze at. That's for sure.
Yeah, exactly.
And especially if you're in California, when that's probably 2 months of electric bills, or a month. 1 month of electric bills. Whew. All right, so we'll wrap it up with these couple of questions. So how can someone make Medicare and navigating open enrollment less overwhelming? What's just a couple of things to keep in mind, again, because it's going to be here in less than a month.
Plan ahead. Start early. That's one thing.
That's why we're talking about it.
Yeah, plan ahead. Always know that if you're going to do something, don't call me on December 6th to get it done by December 7th. So again, I do my annual reviews in October. That's a great time if we have a question to kind of bring stuff like that up, so we can kind of plan ahead on that. Always I tell people I'm a big checklist person. I keep notes diligently throughout the year. Always make sure you have a checklist of things as the year goes on. Again, check the Medicare website. They do have good information there. And again, don't worry about asking for help. I do run into people who are very shy about asking for help on something that's very personal, which is your health and what you have going on in your life. I do have people that are very hesitant to tell me, by the way, I have this issue or this problem. I need this kind of specialized help and this specialized care. Know that we as an advisor, we are here to help you, and we understand that there may be challenges that you have that other people may not have. We're all family here, and we're not going to think anything weird or judgmental about it. If you have an issue, we're here to help you. And don't be afraid to ask me as an advisor, or if I can't help you, again, I will refer you to somebody that can.
All right, so let's take our 2-minute warning question, Coach, as we always do. So we've got one here from Helen who says, my husband passed away a few weeks ago, and his first wife is trying to claim that she's entitled to his life insurance money. She feels that it should go to her because he was still paying her alimony. But I've been the one paying the premiums on the plan for the last 10 years. I feel it should go to me. She wants to know who's right. Who's listed, right, Coach? Isn't that really
exactly it? I just love the dirt on this one, though. I'm just picturing something that is either on the Hallmark Channel or A&E, and why
it definitely feels like a movie. Yeah. I mean, I feel sorry for her that she's going through this, but this is that age-old thing where the BD, right, is the beneficiary designation. That's it, right?
That is all that matters here, because they're arguing about who's paying. That doesn't matter.
Doesn't matter.
It doesn't matter who's getting the alimony or the ex-spouse or this. All that matters is what the beneficiary designation is. And I tell people that all the time. This is why in our office, we routinely go through beneficiary designations, because things change, people change. There are divorces. There are kids that are on the ins or the kids that are on the outs. There are different things that happen. And so we always look at the beneficiary designation. Now, here's the sad truth here is that if the ex-wife, and I've seen this happen, the ex-wife is still the beneficiary in the life insurance, yes, she does get it.
Yeah, she doesn't say, right? She doesn't say who's listed. So Helen, I mean, if you're checking this out, or anybody else who's in situations where their life has changed, who's listed is who gets it. So it's important, to Coach's point there, make sure you got the correct person, especially with a remarriage. That's typically where we see the mistakes happen, especially something, Coach, whether it's a life insurance policy or something that's been sitting for 15, 18, 20 years and you haven't touched it in forever and you just kind of forgot about it.
That happens. And I've experienced this personally in my life where I am part of a remarriage as well. And my wife, we were just looking through this just a few years ago. She has a life insurance benefit with her employer. And we're just kind of going through her employer benefits, and we see his name on there.
Yeah. So whoop, let's fix that.
So that was something we did fix immediately, but it was, we kind of chuckled at that. I mean, but yeah, something that happened. That would have been an interesting situation. We'll just call it that. It's something to stay on top of.
Yeah, so to answer Helen's question, Helen, since you didn't tell us, whoever is listed on the policy, and I think there's been tons of court cases, right, Coach, where they've gone to court for these different things, and I don't think that I don't think there's been any rulings where they've changed. I could be wrong, but I think usually it winds up going to whoever's listed on the BD.
I have not heard of it being, and that's one thing that's an easy way.
It's a quick fix.
Company it's very easy. It's very apparent. It's right there.
Yeah.
I don't know of that being contested successfully. I'm probably wrong. Maybe somewhere.
Right. Although I will say I saw a wild story. I don't know the end of it, and I can't remember all the details. But it was an older one, and I want to say it might have even been PG&E. But the guy started working there and listed his girlfriend like back in the early 80s when everything was on paper. And then, he never got married. He never did anything. They broke up or whatever. And he never took her off. He just totally, because it was on paper. And I guess part of the digital conversion at some point or whatever. Anyway, the whole thing got wild. He passed away. She's listed, so she's entitled to the money, but his family, his brothers, I guess, or something like that, are contesting it. I think it might still be going through. We have to look. Maybe we'll have to do a follow-up podcast on that. But it was a kind of a wild one where it got even more complicated because I think PG&E or whoever the company was, maybe it was Procter & Gamble, I can't remember. Either way, they wound up, like during their conversion from paper to digital, they lost the stuff. So it's kind of like,
there we go. Now that's
right?
Entertaining. Yes.
Yeah. Right.
Yes.
So it can get a little hairy, but I think usually it's cut and dried though, right?
Yeah. They still have the old slip. I'm still pretty sure the ex-girlfriend, the old girlfriend would be getting it if they still had that. So that's what makes it more fascinating is we really don't have a record of it. And that's why we love, again, the Hallmark Channel. Sometimes. Yeah,
there you go. Exactly. Mm-hmm. And again, it's a quick fix for people. So, a couple things to think about, like if you've had a death in the family, make sure you're changing that or taking a look at that. Disability, they call, I think it's the 4 Ds, right? So death, disability, divorce, and there was one more, and now I can't think of what the 4th D was. But either way, so those are kind of the big reasons that you might want to check. Or to Coach's point, just check them annually. When you go in for your review, usually a good advisor is going to say, hey, what's happened? Anything changed that we need to know about?
Yes, we go through all this, and if there's something that is not something that we manage, we still ask the client to double check that. So we bring it up. It's low hanging fruit. It's easy to do, and actually, if it's not taken care of, one of the biggest pain points that exists out there. So.
Yeah, clearly. I mean, it's a problem for Helen. So there you go. Hope that helps. And if you need some more help, we've got a little option here for you to check out as well. John has a couple of free books, Diffuse and Tax-Free Retirement in California, that reveal exactly how you can experience zero taxes in retirement and overcome the IRS lien on your 401k, IRA, and 403b, which could threaten your future lifestyle. These are complimentary, so all you have to do to pick these up 100% free is just stop by rescuemyretirement.net. That's rescuemyretirement.net. Fill in the basic info and he'll ship those out to you immediately. That's rescuemyretirement.net for a copy of Diffuse and Tax-Free Retirement in California. All right, that's going to do it this week here on Red Zone Retirement Program. Simple Investing, Smart Future with Coach John Mears and myself. We appreciate you guys hanging out with us. Keep subscribing to the channel. We've been picking up some new subscribers and people watching the videos. So thank you very much as we've made this conversion from audio to video. We're doing both. So whether you're an Apple user or a Spotify user for audio form or video form, you can find us on YouTube. We've got some new short videos coming out from Coach as well, some different content for you to consume. So if you got questions, need some help, check the show notes description on any of those formats. We got links back to John's websites on how you can get a hold of him. You can go to mearsmoney.com. You can go to bookachatwithjohn.net. But you don't have to remember all that stuff. Just check the show descriptions and we'll have that there for you. So thanks for hanging out, Coach, and breaking it down. I always appreciate you.
A lot of fun. Yes.
Man, have a good week and stay cool out there. It's the end of August, still hot.
It's still really hot.
Yeah, it's still really hot. So we'll see you next time here on Red Zone Retirement Program, Simple Investing, Smart Future with Coach John Mears.
Advisory services offered through Mears Money Management, Inc., an RIA registered in the states of California and Texas. California Department of Insurance License number 0685203.